Surgery isn't the most thrilling thing to hear from your doctor, as we tend to think hospital stays, long recovery, and even pain. But today, there are minimally invasive surgeries being performed, and the University Health Partners of Hawaii and the John A. Burns School of Medicine are leaders in this practice.
The surgery department for University Health Partners of Hawaii actually is a faculty practice in surgery for the medical school. And we do all kinds of general surgery. We do GI surgery, endocrine surgery, which is thyroid and parathyroid. One of the big areas of focus for us is minimally invasive surgery. Back in the early 90s, general surgeons got a hold of minimally invasive surgery, which is actually laparoscopic surgery for all intents and purposes. We do it through small incisions, anywhere from a few millimeters up to 1 or 1.5 centimeters. We use small instruments and we do all kinds of surgery. So if you had your gallbladder taken out in the 1980s, it would have been through a big incision. Now we take it out through 3 or 4 small incisions, and the recovery time shorter. People actually go home the same day now when they have their gallbladder taken out if it's uneventful. And so it's really doing the same operations through small incisions with better, quicker recovery and better cosmetic outcomes really for patients as well. People are always anxious about surgery. It's the rare person who says, oh yeah, I want to have surgery. We understand that our job is to make sure we provide the highest quality care, and part of that is making sure we stay on the cutting edge of what's available to improve outcomes, patient safety, and also do it in the least invasive way possible. So our group is really focused on trying to make sure that we stay abreast of all the latest developments. It's constantly changing. That's one of the really exciting things about surgery, is just when you think you're up to speed, something new comes along. The robot's one of those tools now that nobody really knows out there what's the role of the robot. It's really an advanced tool, a computerized tool that helps us do surgery. Some of the things we couldn't do before that we can do now through laparoscopic or minimally invasive approaches as well. Our first job is to make sure we take the best care of them that we can. And if it means we can do it through minimally invasive approaches, great. If it means we have to do it through a bigger incision because it's a safer way to do it with a better outcome, then we'll do that as well. The faculty practice actually has clinical offices in surgery at Queens in the Physician Office Building 2, or POB2. We have an office at Kuakini where we have 5 surgeons as well. And now we're just opened a new office at Queens West Oahu campus in Ewa Beach. So we will have full service in general surgery at all 3 sites. We encourage people to work through their primary care physician, but if they're struggling getting a referral or they're not sure whether they even need to see a surgery, call us. We're always happy to talk to them. We're always happy to try and guide them through the sometimes complex healthcare system.
This segment is sponsored by University Health Partners of Hawaii and the John A. Burns School of Medicine.